Which of the following tests is most appropriate for confirming the diagnosis? 35-year-old man presents to the clinic with fatigue, weight loss, and recurrent episodes of hypotension. He also reports increased skin pigmentation, particularly on his hands and oral mucosa. Laboratory tests reveal hyponatremia, hyperkalemia, and low serum cortisol levels. Which of the following tests is most appropriate for confirming the diagnosis? So when I see, fatigue, weight loss, and recurrent hypotension, I do think like an adrenal. I feel like it's like an adrenal, maybe like a thyroid issue or like an adrenal issue. And I see increased skin pigmentation. That tells me immediately it's I believe it's Addison's disease, or maybe
Okay.
is it Addison's? Something primary something. I
Okay.
think it's
Okay.
primary renal insufficiency.
Okay.
So that's Addison's disease. And so the way you would test that is not C, I don't believe. Not, is it? Oh man.
Okay.
No, it's
Just
not a
talk to me.
metapnephrin. Sorry
So,
again. Go
so the
ahead.
way I would do this is, I mean, where you're at, I think you're in the right direction. So now you have to ask yourself, okay, which ones do you not want to test? Those are sometimes easier to start with, you know?
I don't want to test thyroid function. I don't want to test metanephrine because
Okay.
that's telling me pheochromocytoma. That's not it.
Okay,
I
good.
don't believe it's cosintropin.
Okay.
And so dexamethasone is when you test the pituitary gland,
Okay.
and you see that like can suppress it. So I guess I would go 24-hour urine cortisol.
Okay. So
Um,
I don't remember this, to be honest. So let's kind of work through it together. Okay. So definitely for sure, right? You kind of have the right primary adrenal insufficiency. So diagnosis on lock. Okay, so that's good. Okay, so now let's talk about, okay, so you got the Addison's disease, you got the diagnosis correct. So now let's talk about this cosintropin simulation test, which measures the cortisol level before and after administration of synthetic ACTH, is used to confirm the diagnosis in primary adrenal insufficiency. So cortisol levels will not rise appropriately after cosintropin administration due to impaired adrenal function. So let's talk about kind of what you chose as another test used to evaluate Cushing's syndrome, but not adrenal insufficiency. So I guess the question is this, right? So let's say you measure cortisol levels and it's low. Okay. So you're thinking to yourself, okay, what does that tell you? You understand what I'm trying to say? So you don't know per se, is that a brain issue or is that a adrenal issue? You know what I'm trying to say?
yeah, yeah.
Right? Because this is how I think of it, at least, right? So, which one gives you better information here? Okay, so usually cortisol levels you can use for instance, when they talk about Cushing syndromes and things like that, right? Which is too much cortisol, that helps you there, right? Because you've diagnosed it, right? But if you talk about low cortisol levels, right, then you have to ask yourself, is it your brain not creating ACTH or is it your adrenal gland not creating cortisol? You don't know, right? You're still missing it. You can't confirm the diagnosis.
Yeah.
Okay. So now the question is, and also dexamethasone suppression test, right? That's dealing with, like you said, that's like a little bit of the pituitary. Which one is secreting it? Is it the adrenal gland secreting cortisol, or when you give it, it suppresses it? Then you know it's the brain. You get what I'm saying? So like that's a little bit different. So you know that those are really used mainly for overproduction of cortisol. So then when you're talking about Addison disease, you want to isolate where is the issue where you're not getting cortisol, if that's what you're thinking here. And
Uh-huh.
it does fit here that you're not getting that because you have hyponatremia, hyperkalemia, and low cortisol. So you already know there's low cortisol levels, right? So if you're doing a 24-hour urine, does that give you more information than
It does
this?
not. It would not. And so you would try to stimulate it somewhere to see if it would be predict. See, looking back at it,
Sure.
like, oh yeah, 100%. How did I miss that? But like, yeah, that makes complete sense. It's like the 24 year an hour cortisol wouldn't tell me anything I already don't know. Like I already know.
Exactly. Exactly. So couple key things here, right? So figuring out, right? Sometimes like reading that sentence over, it's like, oh, they gave you that information. They have low cortisol levels, right? So you have to ask yourself, what do you want to do to give yourself more information to confirm, right? You're trying to confirm the diagnosis, which you're right, it's Addison disease, right? You're 100% there, right? So key takeaways here: read a little bit closer. Number two, right? Ask yourself, okay, so how do I tell, like, what test do I need to run to be like, oh, the adrenal gland's not working? Well, if you try to give them ACTH and nothing happens, bingo, you know that your adrenal gland, which creates your cortisol, is not working. So you confirm that it's a Addison's disease.
Okay, makes sense.